with the severity that we've seen with COVID, erring on the side of being extra safe is probably the way to go in general. That's, the first broad answer with that. Symptoms that are usually specific to allergy are things like itchy nose, itchy eyes, sneezing. Certainly, you can have those symptoms with COVID. So, probably by far and away, I would say if you're having any of those things, and especially if you haven't been an allergic individual previously, it's probably better to be thorough and get tested to COVID. Speak to your doctor if you have concerns, that you're having new symptoms. The other symptoms that would probably tip you off in terms of being a bit more worried about COVID versus allergies is actually feeling sick. So generally, patients who have allergies, the symptoms can be quite invasive, but you don't feel like you necessarily are sick with a cold. Fevers would also be very atypical of allergy. You should not be getting fevers with allergies. So if you're experiencing any fevers whatsoever, and although allergens can impact breathing, especially in patients who also have asthma, certainly with COVID and respiratory symptoms being a major symptom that we're seeing, I think if there are any symptoms like that are developing, then you should be thorough about making sure that COVID is not the problem in the first place, and then potentially seek out further care for your allergies. We are always happy to speak to any patients about allergy concerns whatsoever. It's not wrong to seek out an allergist at any point if you feel like you have allergies, despite the degree of severity. If they're controlled on over-the-counters medications or not. There are, in speaking to an allergist, you will get a thorough evaluation of, potentially other things that can contribute to allergies. So sinus disease, things like that. We'll often at least talk about asthma just to make sure that's not an issue as well. One thing that we do uniquely as allergists is we do offer allergy immunotherapy, which are the allergy shots. That's not necessarily the right therapy for all patients with allergies, but it may be. The goals of that therapy being to actually make you less allergic. So some patients may be well controlled on over-the-counter therapies like antihistamines or the nasal sprays, which we preference using often. But they may not want to be allergic long-term. And that is the benefit of the allergy shots, which is that over time we desensitize you. We essentially reprogram the immune system to become tolerant of these allergens with a lasting effect. So certainly if the allergic symptoms are invasive, are impacting quality of life, and you'd like to sort of knock that down as best as possible, that's absolutely the time to come speak to an allergist.